Is Houston Newsmakers with Cambrell Marshall.
The economy of the state of Texas is starting to reopen. Much has been talked about regarding the timing of such an opening. Is it too much too soon? How much longer can the economy wait? How many more people will die from COVID-19 related causes? And how many of those additional deaths will be attributed to opening too fast or too soon? The answers to those questions, of course, aren't known right now, but there is plenty of science that indicates what might happen in the weeks and months to come. Experts on the front lines have been telling us what we might expect, while politicians have been telling us their plan of action takes the experts' input as guidance. Dr. Peter Hotez is an expert, a physician scientist with an MD and a PhD whose expertise is vaccines. He is the dean of the National School of Tropical Medicine at Baylor College of Medicine as well. And he is also a professor in the departments of pediatrics and molecular virology and microbiology. That's a mouthful. Dr. Hotez, thank you for joining me. I appreciate it. Good to see you again.
Great to see you. Thanks for having me back.
Let's talk about vaccines. What have you heard in the past week or so that gives you some optimism that there may be a vaccine that has promise as far as COVID-19 is concerned?
Well, thanks. We're also developing a vaccine, and we hope to contribute to what's getting to be a pretty big list of vaccine candidates that are moving into the clinical trials pipeline. And you need those many candidates if you want to turn this around quickly, because although the theory behind it is not complicated, it's about making an immune response to that virus spike protein. We've all seen those pictures of the virus that look like a donut with spikes sticking out of it. So if you neutralize that spike protein, you can get a vaccine. The problem is which is the best way to do it and which is the safest way to do it. So we have one approach with a specific recombinant protein technology, but you're hearing about all sorts of other ones. And at the end of the day, we don't know which is going to be the best in terms of giving the best level of protection and safety. And so it's all moving into a series of clinical trials, and hopefully by next year sometime we'll have a few vaccines that look like they're promising.
And so a lot of people have been kind of hedging on how long it's going to take. That number of months really hasn't changed very much, has it, in terms of how long it might take to have a vaccine ready to go and put into public use?
Yeah, there's been quite a bit of confusion coming out of the White House and elsewhere about the vaccine program, and we need to up our game in terms of communications. I think what we're hearing a lot about is the fact that the White House is going to organize a series of manufacturing programs. So several vaccines will be already scaled up and manufactured even before we know if they're going to work or not, or if they're safe. And the idea is, because if one or two of them show to be the case, then we can have them ready to go. So you're hearing about manufacturing by the fall, and I think that's a possibility, but I don't think we'll really have a vaccine ready to go at the earliest next year. And even if it's ready next year, that would still be a world record. I think the world record is around 4 years, and now we're concentrating that down to a year and a half, which would be extraordinary.
Well, in the meantime, here in the state, Congressman Brady indicated, he said last week that Governor Abbott had opened up a can of common sense in terms of reopening the state. With your background in diseases like this, what's your opinion about what's going on right now? And until there's a vaccine, isn't there always going to be a risk involved when you do something like opening up the state and the country, in fact?
Yeah, it's a carefully orchestrated type of thing that we have to advance. So what do I mean by that? Well, some of the models coming out of Seattle, you've heard about the IHME models, have said that the Houston and Texas needs to socially distance till the middle of June in order to get back to containment mode, meaning that we'll have less than one new case per day per million residents. And the problem is, our economy's already been devastated, and my son is feeling it. He's a petroleum engineer in the oil and gas industry, and we all know what's happening with oil. So we get the devastation to the economy. The issue is this: how can you open the economy, get people back to work, get businesses open, and do it in a safe way so that we don't see a big resurgence? Because we are opening it up before the models tell us when we can do it safely. So how do you organize that? And I think one of the ways around it is to maximize the amount of testing that we can do in the workplace, and so you know if your colleagues in the workplace, and whether it's a Target or Walmart or a law office, that you know your colleague does not have asymptomatic COVID. And then we do what's called contact tracing, which is identify and bring people in if someone's found to be positive, and then you can get all the contacts and the contacts of the contacts to get them back into quarantine or isolation. And then there are other things like doing syndromic surveillance and public health communication and building models. The bottom line is we need, if we're going to be smart about it, we need to have a public health system in place that's commensurate with all of the plans for economic recovery. And we're frankly not quite there yet. I think the mayor and the county judge are working overtime together with some great departments of health in Harris County and the city to make that happen. But it's hard to go from 0 to 60 in the course of a few days. So it'll take time for us to build up.
So it's going to be a risk, it sounds to me, as we move forward because we're ahead of what the, quote, models have said. Some folks have indicated that they're done with the models because the models indicated just really, really horrific numbers of people dying, and that hasn't happened. Others would say that the reason that hasn't happened is because people socially distanced and did some of the things to kind of blunt that model. What do you tell those folks who are like, well, you keep your models and just let us go back to work?
Well, I think we need humility on both sides, including our side, which is to say that, look, the models are models and they're only as good as the assumptions that we put into the models. And the assumptions, frankly, are not robust because we're still in a steep learning curve about this virus. We're learning new things about it every day. One thing I will say is the leadership of Houston did a good job, and the mayor and the county judge and others, because we saw what was happening in New York City with this big surge on the ICUs and all the devastation and all the thousands of deaths. We said we're not going to let that happen here in Houston, and we wound up socially distancing pretty early. So as soon as we saw what was happening in New York, we implemented social distancing probably before the virus got here in a big way. And the other thing the models tell us is if you allow transmission to go on for a long period of time before you implement social distancing, that's when you get the big surge. So that's what happened in New York. Probably the virus entered New York City in the beginning of February. Social distancing didn't happen until March 22nd, and you got a disaster. Here, I think we probably did it a lot sooner and saved a lot of lives as a consequence.
What's the big difference between, you're so familiar with these vaccines and these pandemics and epidemics, what's the biggest difference with this COVID-19 compared to other outbreaks you've seen? It seems people who are tending to want to compare it to the flu, when I read more in depth about it, it just doesn't look anything like the flu in terms of the way it impacts the community.
Yeah, the really troubling things about this virus is it has two faces to it. I call it the Janus face to it, the Greek Janus, two faces. One, some people are getting very sick, and we're still learning why this virus is making people sick. We're starting to see a lot of clotting disorders. So we're seeing pulmonary emboli, we're seeing coronary artery disease, we're seeing stroke. So that's pretty worrisome for one set of people. And then for another set of people, they do just fine. They're without any symptoms at all or low-grade symptoms, but they're shedding a lot of virus. And this is what makes it so hard to control, is all of those people, maybe up to half with COVID-19, have no symptoms at all. And they're walking around just every time and the virus is replicating in their upper airway. So every time they're speaking, they're shedding virus. And then a lot of people get infected. And so this is highly transmissible. And I can't ever think of a virus that's been quite like this. And it's taken a little bit of time to figure this out. The scientists are working on it day and night. We're working on it day and night. But it makes it really problematic to control it without a vaccine. And that's why we have to go back to 14th century methods, which is when quarantine was invented. And hopefully, one of these vaccines will become available in a year or longer. But in the meantime, the reality is now that we've opened up the city faster than the models tell us we can do it safely, and until we get that health system in place, we will see an increase in COVID-19 cases. And I'm particularly worried about some of the low-income neighborhoods in our city, Cambrell. And the reason is because, how do you social distance in some of these crowded neighborhoods, especially in households where you have lots of people in those households? Number one. The other problem is that in the African-American and Hispanic communities, you have pretty high rates of comorbidities, meaning diabetes or hypertension or obesity. And now we know that those are risk factors for getting seriously ill. So a high percentage of those patients that are in the ICUs in the hospitals of the Texas Medical Center including Baylor St. Luke's and Ben Taub, which is linked to Baylor College of Medicine, have those underlying conditions. And so I'm, in that sense, we saw this in New Orleans. COVID-19 is a health disparity, and it's going to be a health disparity here in Houston. It is a health disparity here in Houston.
Dr. Kotes, thank you so much. We're going to continue this conversation. Thank you for sticking around with us on our Newsmakers Extra portion of this. Thank you for being willing to do that. And good luck to you on the advancements that you're doing and how we can make a difference going forward. Thank you so much for that. I appreciate it.
Thank you.